PG Doctors NEET. It's your YouTube channel.
Hi doctor friends, welcome to my YouTube channel PG Doctors NEET. Today's very important topic for you is the lymphatic drainage of the genital organ and pelvis. This is very important topic for your PG exam, and in all medical PG exam this is very hot topic, so must watch till last. Start with the lymphatic drainage of the genital organ. Some brief review about the para-aortic lymph node, para-caval lymph node, and some interesting things. The para-aortic lymph node is divided into pre-aortic, para-aortic, and retro-aortic respectively. This division on the basis of the presentation of the lymph node around the aorta. That means if we make a diagram of the vertebra, this is our vertebral body, and slightly left to that of the body of the vertebra is the abdominal aorta, and slightly right to that is the inferior vena cava, and around the abdominal aorta the lymphatic drainage are arranged in such a way that if the lymph node are anterior to the aorta, that means abdominal aorta, this is called as the para-aortic. And para-aortic is the laterally situated around the abdominal aorta, and so that's why the para-aortic lymph node are also known as the lateral aortic lymph node or node. So retroaortic, that means retro indicates the posterior to the aorta, and posterior side situated a lymph node is known as the retroaortic lymph node. And another classification, this is due to abdominal aorta is slightly left, so this presentation of the para-aortic lymph node is for the left side, and due to inferior vena cava is situated slightly right to the vertebral body. So another classification of the para-caval lymph node, that means which are slightly right, and this is divided into, this is called as the para-caval lymph node, and para-caval lymph node is again divided to the lateral, precaval, and postcaval. Precaval, that means anterior, lateral, that means lateral, and post, that means posterior side to the caval lymph node. The pre-aortic, mainly we have to focus about the para-aortic lymph node, and many questions ask around this, and this, so this is most important topic. And the para-aortic lymph node is also known as the lateral aortic lymph node. Pre-aortic lymph node is the node which drain the lymphs from the genital organ, that means GIT, to the respective node, and after that from respective node to the pre-aortic node. that means celiac lymph node, celiac lymph node, superior mesenteric node, inferior mesenteric node. From genital organ GIT, the lymphs drain to the celiac lymph node, to superior mesenteric, to inferior mesenteric, and finally this drain to the pre-aortic lymph node. This is the diagrammatic representation of the uterus, and uterus, this is the fundus part, and this is the body of the uterus, and lower part cervix, and the vaginal canal. This is the fallopian tube and the ovary and respective ligament. We have to assume that between that this is the pre-aortic, the area between the this line, area between this line is situated, is midway to the pre-aortic area. Pre-aortic, that means anterior to aorta. So this is midway part between that. To remember, I am making such type of video due to many confusion in that type of the question. This is the pre-aortic area. So the drainage of the fundus and the body of the uterus and isthmus part and some part of the fallopian tube and respective ligament to the pre-aortic lymph node, and this is the boundary. Lateral to that, this drain to the lateral side to the aorta, and lateral side to the aorta, the lymph node is the para-aortic. So this will be the para-aortic drainage of such, that means the major part of the fallopian tube and the ovary, both sides, this drain to the para-aortic lymph node. And also in the male, the testis part, we are making a diagram to the, this is the testicular part, and this testicular part drain to the para-aortic lymph node, that means testis. Okay, then some differences in the drainage. You already remember that this part drain to the pre-aortic and the lateral to that is para-aortic lymph node. The uterus, that means the uterus lower part and the cervix part, this drain to the external iliac lymph node. Okay, cervix and the lower part of the body of the uterus drain to the external iliac lymph node. But some difference are there, that the lower part of the uterus is drained to the mainly external iliac lymph node, while that the cervical part, this drain to external iliac and internal iliac also, and sacral lymph node. That means cervix part drain to the external iliac, internal iliac and sacral, and upper to that both drain to the external iliac. This is the common thing. And if the vaginal part, that means the vaginal canal is if we divide the vaginal canal into three parts: upper, middle and lower. The upper part, due to here this is external iliac, lower part external iliac, so this will also drain to the external iliac lymph node. And this is the upper part of the vaginal canal. Middle part of the vaginal canal is to the again no external iliac, it get drained to the internal iliac lymph node. Okay, this is the another common thing. And lower part to the, due to it is going outward, so it get drained into the superficial inguinal lymph node. Inguinal lymph node. Again I am repeating. Again I am repeating that the to the lower part, this, for the less confusion we are making such of the type of the diagram so that you can easily remember. This is the para-aortic lymph node, this is pre-aortic lymph node, this is external iliac lymph node. Okay, and cervix, this making a block to the again external iliac, vaginal canal, upper, middle and lower. Upper to the external, middle to the internal and lower part to the superficial inguinal lymph node. This is very easy to remember. And this opening, if you make this, the making the diagram of the vaginal opening, then this is the clitoris part, and the clitoris part is also if we assume that this is the vertical cutting And if we look the horizontally or from the lower side, the vagina have the clitoris, and clitoris with the labia majora both get drained to the deep inguinal, okay, to the deep inguinal lymph node from that and from that. This is the very easiest diagram. Another thing is that for major air clearance and some important question asking that this is the connecting part is isthmus, and this part is called as corona, cornua, and this cornua or isthmus part is some specialized, and this part drained to like superficial inguinal lymph node, just like to the lower part, okay. This also drained to the superficial inguinal lymph node, and isthmus and cornua part get drained to the superficial inguinal lymph node, okay. Another thing to the, I've already told that here the testis drained to the para-aortic lymph node. This is for para-aortic, while that of the scrotum part, the scrotum part, this get drained to the this like superficial inguinal lymph node, okay. And another thing, the perineum area, these are situated to the perineum area, that means anus and vaginal opening. This perineal area are also drained to the superficial inguinal lymph node. And another great thing that the our big toe, okay, our big toe also supplied by superficial inguinal lymph node, drained to the superficial inguinal lymph node. This is the good thing to remember. Next thing, this is the male genital organ, and this is the spongy urethra, and this is prepuce. You already know about that. The deep prepuce and a spongy urethra, okay, both drain to the deep inguinal lymph node. Don't make confuse that I am funny to make an image, and you have to assume like that. Okay. Deep inguinal lymph node drained from the prepuce to and spongy urethra. Another thing, the pectinate line. This is the anal part. Okay. Anus, and above that, this is the pectinate line. Okay. Anus part above the pectinate line and below the pectinate, above and below the pectinate line. Above the pectinate line, it is to the internal iliac lymph node, and below the pectinate line, it's drained to the superficial inguinal lymph node. Okay, this is very important. This prepuce and spongy urethra. Prepuce is similar to the clitoris and glans penis. This deep inguinal lymph node, prepuce part, is also named as the cloaquate lymph node. Many times asked. Cloaquate lymph node or cloaquate lymph node of deep inguinal or deep inguinal cloaquate lymph node. Okay. Next to that is a very important thing. This is the urinary bladder, and below that is like the pattern of such and voiding. Here the organ is the prostate. Okay. Below that the hip plate are there, also known as the external, this is the external urethral sphincter. External urethral sphincter. This part is known as the prostatic urethra. Prostatic urethra. Okay. In the external urethral sphincter, this is known as the membranous urethra. Membranous urethra. And after that, this is called as a spongy urethra. Okay. And this separating membrane, this is called deep perineal pouch. Okay. This is the deep perineal pouch. And okay, if we're making a diagram like that, okay, diagram, this is the scheme. Forgot about the spongy urethra. Already told, spongy urethra, and the prepuce, then to the deep inguinal lymph node, and this is the part except the spongy urethra, the corpora spongiosa and corpus cavernosum, those are supplied by the superficial inguinal lymph node. Okay, and the membranous urethra, this is the membranous urethra, and prostatic urethra drain to the internal iliac lymph node and base of the urinary bladder. Okay, base of the urinary bladder to the external iliac node. One thing you have to always remember, that our membranous urethra are drained to the external iliac and internal iliac both, while that prostate is drained to the external iliac, while that of the prostatic urethra to the to the internal iliac lymph node. Okay, again I am repeating, membranous urethra, so another for making clear, this is the urinary bladder, base of the urinary bladder, and again repeating, base of the urinary bladder and the prostate part. Okay, this is prostate, base of the urinary bladder and the prostate are to the external iliac lymph node. Okay, while that of the prostatic urethra and membranous urethra, these both are drained to the internal iliac lymph node, and but difference is that this membranous urethra and the prostatic urethra both drain to external and internal iliac lymph node. Okay, while that, going to the next, spongy urethra. This is a spongy urethra and it is the prepuce part. This is prepuce part. You already know the prepuce and spongy urethra are drained to the deep, these are to the deep inguinal lymph node, and the part except prepuce and spongy urethra to the superficial inguinal lymph node. Okay, these are the prostatic urethra, membranous urethra, and spongy urethra. The difference is that in the lymphatic drainage, while that of the female urethra, whole female urethra drain to the internal iliac lymph node or internal iliac node. Okay, always remember. Many questions ask about the lymphatic drainage of cervix and uterus to accept. You already know the cervix and uterus to the external iliac, internal iliac, obturator also given, parametrial also given, but the lymphatic drainage of the cervix and uterus can't be to the deep inguinal lymph node, and that is the asking question which are given in the accept. Okay, this is the brief review about the lymphatic drainage of the genitalia and pelvis. Any confusion regarding this, you must write in my comments box. Thanks again for watching my video. Have a nice day.